You know, the ED is a place where we take care of everyone in the community, no matter what they need. We're always open 24/7. And this place has changed a lot. So in 2011, I started here as a resident, and we saw about 50,000 patients a year. And right before COVID, after Memorial Hospital closed in Pawtucket, we hit almost 80,000 patients. The patient population that we care for has become increasingly underserved, and we really fill those gaps in the healthcare system for them. So what we're realizing in the emergency department is that because we are a lot of people's solution to the inequities in healthcare, is that we need to figure out ways to solve those problems outside of these four walls. The most challenging resource we face right now is space, because when all of our beds are filled with patients, we have to get creative in how we manage patients. What happens is mobile integrated healthcare becomes a solution that pushes the emergency department outside of these four walls and helps to manage patients who are traditionally using the emergency department because they have no other source of care. Everyone deserves honest, capable, compassionate healthcare. And so street medicine is a way to see people who are sort of forgotten by the system and give them some dignity and tailored care to their needs.
Like in the middle where...
Perfect. I'll take the medical bag and we can pack some stuff up.
And then I just have
Put some in here.
This one has safe use kits.
So, thinking about why people feel invisible here, and I think it is because in a lot of ways they kind of are, kind of like tucked away in corners, and when they go places, people don't see them for who they are. They just kind of take a quick look at them and think they know everything about them. And what I really like is because you get to actually sit down with people. That's what I really love about being out here, is because you get to see who people really are.
Been through a whirlwind of emotions in the past year. So it's been all right, now I am understanding how I need to appreciate things more, like time, things that you can't get back.
Yeah.
Mm-hmm. So I do appreciate the time that you guys spend up here, and just even when I got that concussion, you guys came out the next morning and checked on me, and it was like, okay, thank you. You actually care.
I feel motivated because I just it's gratifying. It's really, I enjoy the interactions and being able to spend the time with people, and I feel like it's something that I enjoy doing. I think they are happy that we're here, and so that makes me want to do it again.
So this is not easy work to do. The people that choose to sort of run towards these problems and try and solve them are very special human beings. And they are passionate about giving care to people who are slipping through the cracks. So community paramedicine, in a nutshell, gets patients out of the hospital when they no longer need hospital level of care, and that has an effect down here in the emergency department because it opens up a bed that I can care for another patient in the waiting room.
Hey, good. How about yourself?
Good.
Great.
See this patient?
I am.
All right.
The patient's first name is Rosa, right?
Yep.
Hello.
Hi, good morning. We're community paramedicine.
So again, paramedicine is sort of this multi-factorial approach to taking care of patients. So we have providers who are comfortable taking care of patients in their home, and we use them in a number of ways. Most specifically is to get patients out of the hospital. There are patients who can't get home because there's no home care services, either to care for them where they live or that their insurance pays for. And so we train paramedics to care for patients at home and do dressing changes and give them medicine so that they can get out of the hospital when they're ready to leave, not when we've arranged a lot of other things that are more challenging to arrange for them.
We can come and do a lot of your blood work right here, and we can double check your blood sugars as well. And there's even some blood tests that we can run here in the home as well, and we can get an instant result.
Bueno, me alegro que eso esté muy bien, y si no hay nada más que hacer, ya la podemos dejar descansar para que se recupere.
When you're doing this work, you're realizing that not only are you benefiting the patient who's in front of you, but you're benefiting others. And the people that are doing this work outside of these four walls make it easier for me to do my job. Community health workers are really integral for us in navigating patients through a complex healthcare system so that they can seek care in a place outside of the emergency department when appropriate.
We're gonna go to DHS today.
Yep.
We're gonna get your food stamp card, get you all settled with that.
Yep.
Okay?
Yep.
Then we're gonna come back here. We're gonna go into the conference room. We're gonna do the application for the towers.
Okay, great.
Okay? We'll submit that. We gotta be positive.
I am.
Gotta be positive. I'm just glad that you were able to get into this program
Okay.
and you're able to move forward from here.
Yes.
You know,
Sure.
we're not just, your health,
Right.
but your mental health, having your own place to stay, your own place to go,
Okay, that's
and not having,
right, yeah.
to be in a shelter, because you've been doing this for a while.
Yeah, that's for sure.
Yeah, you wouldn't be able to take care of it properly
Exactly.
if you were homeless and on the street and not being able to put the proper medication and wrap it and do what needs to be done for it to heal the proper way,
Sure.
Yep.
Yep.
But considering how you were when you first got here
Uh,
to now, I mean, you've made quite an
oh,
improvement.
absolutely, yes. Oh, yeah. If it wasn't with the lifespan and you know what I mean. I don't. Maybe I wouldn't. I don't think I'd be here right now.
We care about you. And we want you to be okay. And be able to move on from here into your own place and have the life that you deserve to have.
So I think it's important to remember that all of these programs are pilots at this point, and they have been enormously successful in their space in navigating patients appropriately to care and getting patients out of the hospital quicker, which opens up beds for us in the emergency department. That is to the benefit of our community. When we are open and accepting and ready to take whatever comes through those doors, it's better for everyone around us. But what these programs need now are resources and to grow and to impact more patients and to impact more rooms, open up more rooms in this emergency department so that we can continue to be open and accepting.